According to the National Safety Council and medical research, 20% of backaches are attributed to inflammation such as arthritis. 10% are due to actual back injuries and other miscellaneous causes. 70% result from degeneration of spinal discs. That's right, aging of the spinal disc material causes the most trouble and can cause extreme pain even from routine body motions. You've all heard the routine warnings about bending your knees and lifting with your legs. We see people lifting boxes to demonstrate the proper technique. Those techniques are still correct, but we don't always pick up a box, or the item we want to lift is sitting under a storage rack or other difficult position. Today, we want to explain how the back works so you'll have enough information to make the right choices on how to lift anything safely. We'll also discuss how strains and muscles work so you can prevent these types of back injuries also. There's no magic formula. All you need is a good attitude about safety and are willing to think about safety every time you lift anything. If you'll do that, it's difficult to have an injury. First, let's talk about the mechanics of the back. Each disc is a circular pad filled with gelatinous substance under pressure. The disc looks like a soft hockey puck with jelly on the inside. The disc works like shock absorbers or springs that provide a linkage to the vertebrae or bones, but prevents any sliding of one vertebra against another. The spinal cord is a bundle of nerves in a protected vertical passage behind the disc area. Nerve roots branch out through spaces between each vertebra and go to different parts of the body. The normal range of spinal movement is shown here, while bending forward and backward. You can see the nerve roots are in a vulnerable position because the spinal cord must bend and flex without the vertebrae slipping out of alignment. It is quite easy to wear out a disc with normal movement. As you bend and move, your discs are working, just like the shock absorbers in your automobile. Discs can become damaged through excessive twisting, turning, bending, and when this happens, the disc may spring a slow leak. Now, as the fluid leaks out, you can lose disc pressure. This loss of pressure in one disc can affect the entire linkage. It can happen at almost any age. You don't have to be old to wear out your disc. Back pain sufferers should pay constant attention to posture, standing, sitting, working, even while sleeping. The lumbar flexion or dynamic posture as shown here helps widen the opening that nerve roots pass through and reduce the chance of pinches. Regular exercise is encouraged, which promotes flexibility of the muscles and all the other body parts to keep you healthy. Okay, let's talk about those muscle strains. Actually, when you stretch, ligaments in your back stretch also. Now, if you stretch too far, these ligaments may tear or overstretch. They can be quite painful. Many times we must lift something over our head, so you're going to stretch your arms to reach the object. The best way would be to set the lifted object on a table or other support. Then reposition the object so your arms are doing the lifting, not your back. As a minimum, reposition your grip on the object to keep the weight centered. Arching the back during a lift makes nerve